Nearly 14 months after the World Health Organization declared the outbreak of COVID-19 pandemic, the virus may not disappear in Nigeria anytime soon. The International Center for Investigative Reporting, ICIR, reports that Nigerian attitude towards the use of face masks and adherence to other preventive guidelines, among others, may prolong the pandemic in many communities across the country. The ICIR spoke with Nigerians.
Do you believe that this virus exists here in Nigeria?
Somehow, yes.
Nothing like COVID-19. I don't believe anything. Nothing like that.
Tunda ni ba likita bane ba. Haka ba zan iya jayayya akan abin da likitoci suka faɗa ba. Haka tunda likitoci sun tabbatar cewa akwai ta, ni ma na yarda akwai ta. Ana cewa coronavirus.
Sure, it exists.
Gaskiya ne akwai cutar coronavirus a Najeriya da kuma jihar Jigawa.
Najeriya zuwa Jigawa ma mun yadda akwai coronavirus is real.
I don't know anything about corona because I know say it not dey exist. So wetin no dey exist, I no fit know something about am.
The truth is that COVID-19 is real.
I don't believe it because we never see them.
COVID-19, I'm indifferent about it. I'm not sure there is anything COVID-19.
I personally believe in COVID-19, but there are some certain things that I really want to emphasize on that usually is to draw my mind back on COVID-19.
According to them, they say it's exists, but I'm not seeing anyone that have affected COVID-19.
As I heard on air, they say there is, but like myself, I've never seen it.
You did a coronavirus,
I know it exists, but I know it is politically motivated.
Actually, I didn't believe that. Well, it depends on how one look at it.
Some people are saying it's real. When some people are saying they are saying it's not real, but I don't know the actual one.
COVID-19 wà. Àwọn náà ń dọ́bìn fún pé ó wà ń ta. Àjẹsẹ́ pé kò sí ìta, kọ́ta kan bí Ọlọ́run ní pé kò jù. Ó bá wa jẹ̀wú ẹ̀ lórí àṣẹ wàhálà ní Nàìjíríà.
Me, I don't believe there's COVID-19.
I don't really think there is something like that in Africa.
Kòrò wà o, nítorí pé kèsè pé Ọ̀yọ́ state yìí nìkan ìní kòrò ní wọ́n sọ pé kòrò wà. Ó wà káàkiri gbogbo ìlú Èbó, gbogbo ìlú Ọ̀yọ́ state, káàkiri Ògùn state. Tí wọ́n ṣe ń kúrò ní Ọ̀yọ́ state tó kòrò wà, ṣé wọ́n ń kúrò fún wa náà ní ìlú Èbó náà ni? Àbí wọ́n tún kúrò fún wa ní Ògùn state náà ni? Wọ́n fi jẹ́ pé káàkiri a ti ń gbọ́ ní gbogbo ìlú. Ló fi àjájú ìgbà pé kòrò wà ní tòótọ́ wípé kèétí tàn.
Bọ́n ṣe ń sọ náà là ń gbọ́. Adẹ̀ǹfẹ̀ ti gbọ́ pé nǹkan báyìí ń bẹ orí.
Àrà àwọn tó mú Nàìjíríà wà yìí. Àṣà ń gbọ́ pé imú wọn ni àsìfojú kàn wọ́n. Wọ́n sì lára wọn yà wọ́n tára wọn yá náà àfojú kàn wọ́n. Tá a bá kábílà nílùú Èyìnbó, tá a bá rí wọn, àmọ́ rí wọn níbi tí wọ́n tẹ́ wọn sí kòkòrò mú wọn. Lọ́yọ̀ọ́ wá ń bí àyè rí wọn. A kàn mọ́ fẹ́ síbi kòkòrò mú wọn ni.
Face mask was introduced globally to curb spread of the virus. But while some Nigerians conform to the use of the face masks, others oppose strongly.
Wani lokacin na rufe, wani lokacin kuma ina sake numfashi na zama da abu ina toshe kuma kaina yana damuna. Isa wa kullum.
An sai ina kashe mutane da amma ba da aka yi muka ji amma ba mu gan shi da ido ba.
Coronavirus gaskiya ce.
Coronavirus, the way they are talking, sometimes it makes us not understand what they are talking. But the way I'm seeing it, I believe there's a coronavirus. Other Western world, but Nigeria are still confused with the reason our government is people that don't say what and stay from the word they say. So if there is a coronavirus, I never did shock.
Okay, my nose mask, I am not putting my nose mask because already as I am standing here, I'm just in my home. I am just staying in my home, I am relaxing. So that is why I'm not, but when I am, anytime you see me going outside, you see me with all my COVID-19 protective equipment.
Yeah, because my religion teaches that when there is something of this type, You should not. I know that nothing will happen to me, but I have to take a preventive measures so that even if it do exist, it will not harm me.
Actually, since I'm a Nigerian, if there's any protocol to follow, I have to follow.
For me, if I say that I believe that there's COVID-19, I will tell you that there is a big lie. But from what government said that we should do, we are doing it. There's a basket, you look at that bucket, our water, wash your hand and what's the sanitizer.
àwa ti rí ẹnìkan tó lò láàrin wa nígbà ọ̀yá báyìí lẹ́nu máa ń ga báyìí ẹnu ń ga báyìí ẹnu ń ga báyìí nígbà tó ṣe tí atẹ́gùn ọ̀fẹ́ sí ṣé etí kọ́. ṣe rí ní tá a fi ń kọ́pà yìí ṣé ẹnu nìkan ṣé ẹnu nìkan àti mú nìkan atẹ́gùn bá wọnú ara wa tí atẹ́gùn ọ̀bọ̀jú wọlé ọ̀bẹ̀jú wọlé ẹran ara tí atẹ́gùn ọ̀bá bẹ̀ wọlé ó yẹ kán lọ rán ìdábòlẹ̀ kọ́mọ́ tiẹ̀ káde eégún àbẹ̀lẹ̀ hà.
mi kì í lò torí mi rìnrìn pé kinní mi lò.
so nítorí pé ẹ̀yin ò kàn tiẹ̀ bíbí pé kòrò bẹ̀yìn ò tiẹ̀ kì í lò rárá.
mi gbàgbọ́ kó wà lọ́hùn sí járí.
oníjẹ́ máa fẹ́ jẹ́ èèyàn mi dáadáa ó máa ń mú sí ní atẹ́gùn sọ̀yà kó máa wọnú ara ó ń dín kòkò jẹ́ kí èèyàn máa lé kókó so bí mi ò ṣe lo fífo wí so ara mi wà òkè ó wà lápò mi ń bí bẹ́ẹ̀ bá ìpọ́n bẹ́ẹ̀ gbowó ti ní ìjọ ní báńkì mi ò lè fi gbomú.
táwa sọ pé à ń fetí gbọ́ kò tí ì mú wa we have to protect ourselves bí mo ṣe wà yìí mo ní nose mask mi wà lọ́wọ́ mi mo ń lò ṣé mo yẹ ìbọn sí ni.
Despite the devastating effect of the virus, many remain doubtful about its existence, believing that the chances of them or their loved one contracting the diseases is slim.
Do you believe that this virus can affect you or affect your family?
It cannot affect me and affect my family. Nothing. Fever, only fever. Maybe the fever medicine for us to take. Nothing like corona for Nigeria. Malaria, typhoid. Maybe they find the medicine for us. See, they kill people. Many people is they kill them. Maybe they go find medicine. Nothing like coronavirus. They live for hungry. How many months? So nothing like coronavirus to see here. I don't believe at all.
Tunda an yarda da akwai ta za ta iya min illa ko ta yi wa wani na ma illa sosai ma tunda abu ya nuna cewa an nuna ma wa'anda ta yi wa illa a zahiri kan ko ba za mu yi kokonto akan haka.
Na'am za ta iya yi amma ba yanzu ba saboda ba ta zo wajajen ba.
I believe that's why I'm putting on my face mask to protect myself.
Affect yín àti àwọn family.
Ó affect mi nípa ọrọ̀ ajé mi nípa ṣoṣù náà torí mi màá pàṣẹ tó lè wáyé mi màá pọ́lúdé tó lè pẹ́ ni. Àbẹ̀ lọ́rùn ọdún bẹ́ẹ̀ mọ̀.
No believe at all because since this is start I never see one person. I never show, I never mention name. I never mention the name of the campaign Johnson or my neighbor or my street or my village or my I never see anybody so that they listen Johnson.
What I observed that the coronavirus is what happened in Nigeria, which is typhoid malaria. We have been in Nigeria, somebody sneeze, somebody cough, all those things have been happening before you turn into coronavirus. I believe that there's nothing coronavirus can worry my family because of what? We are putting all the protocols according to government.
I am yet to come to terms with the virus, with the disease called COVID-19. Number one, on several occasions I have seen so many people say that they have been told they are COVID-19 patients for just coughing, and there is no clear-cut symptom, particular symptoms for the ailment.
CDC, they are not just transparent on what they are doing. If they really want people to like put more effort to encourage people to know that COVID-19 is real, I think once someone is having COVID-19, they should display his picture so that we can go and confirm from him, rather than making it hide and seek game, increasing number. I personally, I believe in COVID-19, but my major problem is the transparency is very poor.
A yanda corona yake da yawa a duniya, da yanzu a zaman da nake nan da na ga mai corona. Wata na kai shekara 5 ina zama a nan wurin, ban taɓa ganin shi ba. Kawai sai a zo a ce ban ce ba ciwo ba fa, akwai ciwo amma corona ba gaskiya.
Shekara mana samun na
kowane shekara sai wani annoba ya zo a duniya. Kowane shekara sai dai na wani shekaran ya kuma wani shekara, amma corona ba gaskiya ba. Inda corona gaskiya ne, mutanen Najeriya an kasa su kashi ɗaya za su mutu. Yanda ba ma bin doka a Najeriya. Gwamnatocinmu ba sa kula da mu. Karki manta nan wurin ruwa ne yake fita. Yana wari. In yana kasashen da suka ci gaba ne ba za a bar wannan ruwan ya fita ba. Mun san me muke yi fa. Suna siyasa da mu ne, suna business da mu kawai shi ne.
Wannan kawai dai wannan normal abu ne wannan wanda yake faruwa ko ba haka ba. Dama yana kashe mutane tun dama muran yana kashe mutane. Kawai yanzu abin ya shafi wayanda su dama bata shafe su bane, shi yasa kake ga ake ta yada wa'annan abubuwa.
Kaman su waye kenan, kana nufin tura?
Kaman manyan mutane da kuma turawan wanda suke zama a can inda suke jin daɗi.
Haka. Wannan bayani me kake nufi da akwai siyasa a ciki?
Siyasa wanda nake nan da na fahimta akwai a ciki shine kamar yadda kasashen da suka ci gaba su duk da ilimin mu bai kai ba, amma muna ganin akwai wani buri ne da suke so su cimma burin su akan amfani da wannan cututtuka. Saboda bisa yanayin yadda muke ganin yaduwan annoba da take faruwa a duniya, akwai annobobi wanda suka faru a baya wanda suka fi wannan tsanani, wanda suka yi tasiri, wanda ya sa an ɗauki mataki da ya kai mu an dakile su da wuri ba tare da an yi ta yayata su irin yadda ake yayata wannan ba. Kasancewa akwai irin su cututtuka su ebola su waye da sauransu, duk da lokacin ma gwamnatocin ma musamman irin namu ma muna ganin gwamnati wanda kan bata damu da al'umma sosai ba, amma ta ɗauki mataki.
The so-called superpowers, the developed worlds, so to call them, they created it deliberately in order to get rid of people, especially those from the developing world. So they did it intentionally because they know the developing countries, they are aspiring, they are developing to maybe reach them in terms of economy, in terms of.
But more people have died in US, in Italy, and a lot of other developed nations.
They may decide to do that. They created into their own laboratories. So they started from their own countries, so that the developing countries should see that okay, this thing is real, so that they create panic into them, so that they should believe there is. But I know they did it deliberately in order to see how they can maybe reduce the population of the developing countries.
Actually, I view it as a political issues. Why? Because if COVID-19 actually exists, at least it should have been real. But we only heard on radio, we see in TV, stories on newspapers and other media outlets only. But we have not seen it in the hospital that this one died of COVID-19. Only news. It gives.
Okay. So why do you feel we have a special immunity as Africans?
Looking at the nature of the site, the weather, the environment, it is one of the factors that contributed to our being immune.
But many scientists will disagree with you, Abubakar.
It depends on their perception.
If that way, everybody was fruitful to people, I might believe I want to wa. But due to the system that find there, òtítọ́ òbí bẹ́ẹ̀ fẹsẹ̀ múlẹ̀, so àwọn èèyàn òbí bẹ́ẹ̀ nígbàgbọ́ lórí àwọn ìjọba pẹ̀lú gbogbo bí wọ́n ṣe ṣàlàyé pé COVID-19 wà, àwọn kan máa ní àwọn ìjọba ń parọ́ ni wọ́n fi yẹn make owó ni so corruption tó ti wà on ground ló fà táwọn yẹn kí accuse àwọn ìjọba pẹ̀lú pé COVID-19 yìí o wọ́n fi make owó ni but ọlọ́run tó máa ṣàánú Áfíríkà ni pé ọlọ́run rí wa bá ṣe rí so tá bá wo Áfíríkà our well developed. ọlọ́run rí wa pé àlẹ́ nìkankan àfi ọlọ́run tọ́lọ́run tí COVID láti wá tí wọ́n sọ pé kó spread bó ṣe spread ní Europe country all over the world ó máa really affect Africa gan.
Though doctors have confirmed the deadly nature of COVID-19 and have advised people to take prevention such as wearing face masks, keeping social distance and engaging in regular hand washing, these protocols are often disregarded.
Well, about the notion of people claiming to have breathing problem or swollen mouth while using the face mask. Okay, maybe for the breathing problem I can say it's possible, especially for those people with health challenges like asthma, upper respiratory tract infections, catarrh and some allergies. It is possible to have breathing problem. But for the swollen mouth, I don't think it's possible. I have never heard of it. And I won't be part of those saying it's true because I've never seen that. And I think the advice I will have for those having breathing problem under the face mask, yes, maybe while using your face mask, there is a guide on how to wear the face mask. If you can wear it appropriately, there is an iron on the face mask. That iron shows that is the upper part, which should be at the bridge of the nose. If you can put it on at the bridge of your nose and clip it properly, it will give you a breathing space while under the face mask. You can breathe while using the face mask. Actually, yes, our regular face mask. But for N95, yes, N95 is too tight that in some people it is so airtight you find it difficult to breathe. Many people have even not just breathing problem but headache comes while using such masks. So I think if you wear your mask appropriately, and everything will be fine.
I've heard and I have seen some people who complain about having breathing problems, and mostly people who either have like background medical problems, especially breathing problems, upper respiratory tract or lower respiratory tract infections and thereabout, or even people who have had COVID before. Most people have complained about having prolonged breathlessness or difficulty in breathing, so that is true. What I would say about those people, the advice I have for them is when you're alone or when you're in a place where, for example, you're driving, no need to wear your mask. You're driving alone in a car, no need to wear your mask. Remove your mask. So as much as possible, intermittently, you can go out of a crowded place. If you're in a crowded place, go out to a place that there's air. Take out the mask for a few seconds or minutes, taking deep breaths, try to do some breathing exercises and then put on back your mask. So as much as possible, when you can, then wear the mask appropriately. Then about swollen lips, I have never heard of that. Maybe some I don't know, hypersensitivity reactions, but I have never heard or seen anything like that. So I don't even have any advice on that, considering that I have never seen or heard. Thank you.
You feel like your breathing pattern has changed, you start to act differently, and then you start to get anxious. It's not that the mask is the problem, it's the psyche of the person. So when it comes to dealing with that, first of all, you have to tell yourself that, the mask isn't the problem, I have to get comfortable with it. And then wearing a mask, do that when you go outside, when you absolutely need to, when you're interacting with people and all of that. When you're back in your home and it's just you don't wear a mask. So it's just for the time frame when you're at a risky place or in a crowd, or you're interacting with people and you don't know what they've done and you need to protect yourself. So wearing a mask shouldn't be a problem. Second one is the swollen mouth. Now think about, there are studies that have also shown mouth infections, yeast bacterial infections due to mask. But the thing is, it's not the mask that is the problem. What actually happens is that, with these things, people don't, take care of it properly. People reuse mask a lot, and
Oh, okay. So I said what World Health Organization has said is that all the regulatory bodies in the African countries should collate the products within their countries, and then the World Health Organization African region would have a meeting with the countries, and they will develop a plan on how to evaluate these products. But first, we need to have those products registered with NAFDAC for NAFDAC to even know that people have potential products, and then this can then be evaluated to find out its effectiveness. Yeah, so that's part of what is called the COVAX facility. This is a facility that has been extended to third world countries to ensure equitable access. And so the World Health Organization is really working on equitable access to vaccine. That means that vaccine should not only be for the rich, the vaccine should be available to all that need it.
Not just at this problem, like younger adults may have carried the virus, but they don't have severe disease, they don't come down, they're asymptomatic. But the older adults are even worse at it because they come down and with severe infection. And how many were really vaccinated? A small proportion compared to the many we have. So they may see the pockets, there are still pockets of COVID here and there. So once you come in contact with a susceptible person, you stand the risk of transmission. So if you are not careful, if we get so loose, because the herd immunity, we still not achieve herd immunity. We'll actually be talking of infection if we get too loose. So it's good to still maintain that, at least when we're in a public gathering, we wear nose masks. Yeah, it's still good to maintain those precautions. Despite the vaccination.
Okay. What's the expected population of people likely to be vaccinated before we can say we can attain herd immunity?
At least 70%.
Oh, 70%.
Yes.
Okay.
So we still have a long way to go.
Yeah.